Hello, my name is Jennnifer Cinnamon, and today I'll be discussing brucellosis, a zoonotic infectious disease that is important for healthcare providers to recognize due to its occupational risks, nonspecific symptoms, and potential impact on patients and the community. I will review who is most at risk, what causes the infection, where and when testing should occur, why this disease matters, and how we can protect clinic staff and patients. Brucellosis most commonly affects individuals who have direct contact with animals or animal products. High-risk populations include farmers, veterinarians, slaughterhouse workers, laboratory personnel, and people who consume unpasteurized dairy products. In a clinical setting, patients at higher risk may include those with occupational exposure, individuals who have traveled to endemic areas, and people with weakened immune systems. Laboratory staff are also at risk due to potential exposure during specimen handling. Brucellosis is caused by bacteria from the genus Brucella. Risk factors include handling infected animals, exposure to animal birth fluids, consuming unpasteurized milk or cheese, and accidental laboratory exposure. The bacteria are highly infectious and can enter the body through broken skin, mucous membranes, inhalation, or ingestion. Testing for brucellosis should be performed in clinical laboratories equipped to handle high-risk pathogens. Blood cultures, serologic tests should be ordered when patients present with persistent fever, night sweats, fatigue, and joint pain, especially if they have relevant exposure history. Because Brucella species pose a risk to laboratory staff, specimens should clearly be labeled, and laboratories should follow biosafety protocols, often using biosafety level 3 precautions for culture handling. Brucellosis has an incubation period ranging from 1 week to several months, most commonly 2 to 4 weeks. Humans are not typically contagious to other humans, except in rare cases such as blood transfusion, organ transplantation, or breastfeeding. Patients may remain symptomatic for weeks to months if untreated, making early diagnosis and treatment essential to prevent chronic infection. Brucellosis is important because it is often underdiagnosed, can become chronic, and may cause serious complications such as arthritis, endocarditis, and neurological involvement. For clinic staff, it represents a significant occupational hazard, especially in laboratories. For patients, delayed diagnosis can result in long-term disability. For the community, it highlights the importance of food safety, occupational health, and disease surveillance. Brucellosis is transmitted through direct contact with infected animals, inhalation of aerosols, or ingestion of contaminated food. To protect clinic staff, standard precautions should always be followed, including gloves, gowns, and eye protection when handling specimens. Laboratory staff should use biosafety cabinets and avoid aerosol-generating procedures. Rooms used for patient care do not require special isolation, as person-to-person transmission is rare. Environmental cleaning should include routine hospital-grade disinfectants, as Brucella bacteria are susceptible to common disinfectants such as bleach and alcohol-based solutions. Proper hand hygiene is critical. Other considerations include reporting cases to public health authorities, as brucellosis is a reportable disease in many regions. Patient education is essential, especially regarding avoiding unpasteurized dairy products and using protective equipment when working with animals. Clinicians should also be aware that treatment requires prolonged combination antibiotic therapy to prevent relapse. In conclusion, brucellosis is a serious zoonotic infection with significant occupational and public health implications. Awareness, early recognition, proper testing, and strict safety protocols are essential to protect healthcare workers, patients, and the community. Thank you.